Hi, this is Craig Amrine at Hidden Rhythm Acupuncture in Tempe, Arizona. One of the most common questions I get from my patients is, how does acupuncture really work? Well, there's two ways to answer this. The first way, we can talk about this from a traditional Chinese medicine perspective and explain how acupuncture needles are used to help restore balance with yin and yang and qi within the body. Now, the problem with this is unless you grew up in China or you've spent years training in traditional Chinese medicine, it's hard to really understand what that means. The second angle is that you can explain this from a Western medical perspective, and I'll help explain really what is going on in the body when acupuncture needles are inserted in certain locations. Through both human and animal studies, there is a large body of literature that helps explain some of these mechanisms. In this video series, we'll explain how acupuncture has been proven to affect several body processes, including pain management, emotional balance, inflammation, and how it strengthens the immune system. How does acupuncture treat pain? Well, the body normally produces chemicals to help dull intense pain, and these are called endogenous opioids. They're produced naturally within the body. The most common of these is called endorphins. When you've heard of the runner's high that runners get, or when an athlete gets their second wind when you're trying to exercise, these are usually the result of a release of these endorphins. Specifically, there are actually 4 types of endogenous opioids for pain management. The first and most common is called beta endorphins. The second is called enkephalin. There's another one called dinomorphins, and the fourth is called endomorphins. All of which are used in pain management and natural pain management within the body. There are now several studies showing how acupuncture can stimulate large amounts of these opioids. The early studies showed how acupuncture can stimulate large doses of beta endorphins. This was confirmed by then injecting a drug called naloxone. Now, naloxone is known to block the receptors of these opioids. It's a term also known as an opioid receptor antagonist. After the acupuncture treatment, when a patient were injected with this naloxone, the pain-relieving effects of acupuncture went away. And this conclusion was confirmed on several studies done on both animals and humans. Well, the relationship between acupuncture and this opioid release was further expanded by experimenting with electroacupuncture. Electroacupuncture, or e-stim, involves hooking up small wires to inserted acupuncture needles and running small amounts of current through the needles. During a treatment, the voltage is slowly increased until the patient starts to feel a distinct tingling at the needle site. And the treatment can last anywhere from 10 to 20 minutes. New studies have discovered how electroacupuncture can stimulate even larger amounts of these opioids. Additional studies took this even further and looked at different frequencies of electroacupuncture. So, for example, they've discovered that acupuncture at low frequency, say between 2 to 4 cycles per second, 2 to 4 hertz, stimulates some opioids in the body, while higher frequencies at around 100 hertz or greater stimulated release of these remaining opioids. So what does this really mean regarding acupuncture treatments for pain relief? Well, the data suggests that to get the full benefit of acupuncture to help treat pain, we would recommend using acupuncture, electroacupuncture or e-stim at both low frequency and high frequency to get the full benefit during treatment. If you have any additional questions regarding these studies, I'd suggest you take a look at the published articles on my website, where I talk about these studies in much greater detail and also list the source articles where these original studies were conducted. Pain management is a huge topic, and we're only now beginning to understand how complex an issue it really is. Well, I hope this video can help explain how acupuncture and its analgesic effects can help treat certain types of pain. While it may not be the perfect solution for all types of pain, it is an effective and incredibly safe alternative to these dangerous and oftentimes addictive narcotics that doctors will prescribe patients. So stay tuned for my next video, where we'll talk about how acupuncture is used to treat emotional disorders, including anxiety, depression, and even PTSD.